Okay, perfect. So looks like we'll have a couple more trickling in here, but we'll just go ahead and get started. So, I just wanted to start off by saying hello to everyone who's here live and for everyone who'll be watching the session once we send it out on the recording. Thank you so much for attending and for sharing our curiosity and interest in these topics of tech and AI and healthcare. My name's Arman Hussain. I'm the head of community here at Neural Consult. It's a huge honor to be sharing the Zoom here today with Dr. Jack Jeng, a personal mentor and role model of mine, and really a true innovator and leader in medicine by all definitions of the word. The goal of this chat here is really just to kind of get you guys interested, engaged, informed as medical students in the field of AI, what kind of is out there currently, what some of the efficiencies and the drawbacks are in AI in medicine, and really just get the student population up to date, because we know that AI is going to be increasing in influence in our field, and we believe that at this point, the way things are done in 5 or 10 years from now is going to look very different. And we believe physicians who are informed, who know what they can do with AI, what its capabilities are, what some of its pitfalls are, and who've really engaged and been curious about the field are those who are best positioned not just to build the tools of the future, but really to be those who are comfortable adopting, who are using its benefits to treat their patients with more personal care, with more kind of that human aspect of medicine, and then also to protect themselves and their patients from some of the pitfalls that may come from using AI in an uninformed way or not really knowing about the technology you're using. So, without further ado, I'll pass it over to Dr. Jack Jang to just kind of introduce himself and give a very brief overview of kind of how he came to be involved with Freed. And then we'll go into like a little bit of my intro and then a more direct Q&A if that works for everyone.
Thanks, Arman. Thanks for that introduction. Hey, everyone. Thanks for your interest in learning more about Freed and AI. I'm Dr. Jack Jane. You can call me Jack. I'm a physician, went to medical school at the Mayo Clinic. Actually graduated from with MD MBA when I was there. Wasn't really thinking about tech or startups when I was a med student. I really did an MBA because I wanted to learn more about the healthcare system. I went to medical school back in 2010, and that was when Obama was passing the ACA, and there was a lot of talk about healthcare reform. And so I would, be asked pretty frequently, "Hey, you're going to be a doctor one day. What do you think about what's happening with the healthcare, with the ACA and healthcare reform?" And I honestly didn't know what to say because in medical school you don't really learn about that. You're learning anatomy and physiology, but you're not really learning about the business of healthcare. So I left in between second and third year of med school to do the MBA and took that time to really take classes in healthcare economics, healthcare supply chain, and just learning about the complex US healthcare system. And my initial thinking was when I graduated that I would, practice medicine, but also try to hold a leadership position in the hospital system. And when I graduated from Mayo, I moved to San Francisco, did my residency training in anesthesia at UCSF. And that was actually how I got introduced to the startup world. I met my now wife when I moved here, and she was actually an early Uber employee. So she had joined Uber back when there were about 200 employees, and she was there for about 4.5 years. When she left, there were 16,000 employees around the world. So she was really there for that hyper growth phase of Uber, and I got to see a lot of what it's like to be in the tech world through her eyes. And actually, we really got more involved in the startup world when she actually had the opportunity to sell some of her Uber shares. This is before Uber went public. And we didn't realize that you could actually sell your shares to people that wanted to buy shares from early employees. And so we actually took the money from selling those shares and actually started investing in other startups. Um, and over the last, 8 or 9 years, we've actually made close to 200 investments in early stage startups and growth stage startups. And when we first started, we were writing very small checks. And as time went on, as we got more comfortable with doing diligence and investing, we started to write bigger and bigger checks. And we actually had companies that went public. We had companies that were acquired. And we also had plenty of companies that went out of business, which is, par for the course with startups. But for my wife, she actually loved that experience of investing in startups so much that when she left Uber, she actually became a venture capitalist and she's now a partner at a VC fund. And for me, I was in residency at the time, and I just really, really enjoyed learning about startups. Reading pitch decks, talking to founders, writing checks. Um, Working in healthcare and practicing medicine, you often deal with a lot of barriers, a lot of inefficiencies. I still carried a pager um, and used fax machines, and investing in startups was very exciting because you got to see what really, really smart people were working on and sort of the frontier of technology and what was possible. And I actually ended up joining my first startup in my last year of residency. I reached out to a company called Scanwell that was part of Y Combinator, which is an accelerator program here in the Bay Area. And Scanwell had developed a smartphone app that could replicate the performance of the urine analyzer that you might find in a lab or in a point of care setting. And it was able to do that using computer vision technology and the camera on an iPhone. And it was the first company to get FDA clearance for this type of technology. And I thought it was really cool because the idea was, hey, people can do a test at home, get the result instantly, connect with the doctor via telehealth, and get treatment. And I reached out to the founder looking to write a check into the company. And he said, we already raised our seed round. We don't need more money, but it's only a team of four and we don't have any doctors on the team. So are you interested in working with us part time? So that was how I joined my first startup. I think that experience really shaped my career. I started working with them, as I mentioned, in my last year residency. So I was doing nights and weekends and, during my vacation time and joined as a medical director, wrote clinical protocols for treatment for UTIs, actually did a lot of our telemedicine consults in California where I was licensed. Um, and over time, when I graduated residency, I stayed on at UCSF as an attending, but continued to work with Scanwell, became the chief medical officer, and we grew that team from 5 people to about 35 people over the next 3.5 years. And during COVID, we actually developed an at-home COVID test, which we did it in partnership with a company called Becton Dickinson. So Becton Dickinson developed the test strip, and we developed the smartphone app that can read the test strip and send it, to public health authorities or to employers or schools for, return to work or test to test to come to test to treat protocols. And we got FDA authorization after going through clinical trials. And when we launched the test into the market, we did it, it was actually perfect timing because it was right before the Omicron surge. And we couldn't make enough tests. And I was actually the one that negotiated our contract with BD, and part of the contract included a rev share for every test that was sold. And I think that BD is a big public company, like $80 billion market cap. They looked at how much money they were paying us for every test that was sold, and they ended up just acquiring Scanwell. So I was very fortunate. The first startup I worked at ended up getting acquired and having to exit, which is not a typical outcome in the startup world, but very fortunate for us. And honestly, the timing was perfect because just a few months later, people really stopped testing for COVID at home, and testing really fell off the map. Um, but from that experience, I just realized how much I enjoyed working at early stage startups. So I joined my second early stage startup. It's called Hone Health. It's a telemedicine company focused on longevity and optimization, specifically hormone therapy for men and women. So men with low testosterone, women going through menopause. It was a little bit later stage. Had a team of about 55 physicians already. So I joined as chief medical officer to lead that team and also help improve the EHR, which Hone had built their own internal EHR to use. And that was a really awesome experience because we got to treat patients in 35 states. We worked with compounding pharmacies and really navigated a pretty complex world of regulations of telemedicine, um, treatment with a controlled substance, which testosterone is. Um, and we grew that team and company, and I worked there for about a year and a half and realized that I really missed practicing because at that time I actually had left practice. And so I decided to go back to practice and join Kaiser to practice anesthesia again. And after working at Kaiser for a couple months, my wife actually was the one that met the founder of Freed uh, first, and she said, "Hey, you should really talk to these guys because what they're working on is really interesting." And at that point, I actually didn't have a lot of experience with generative AI. We were just starting to use some, traditional ML uh, at home with the data that we were collecting from all the lab tests, but we didn't really use generative AI yet. Um, and so, and I personally had only, kind of used ChatGPT a little bit. I just thought it was sort of a, better Google. I wasn't really thinking anything beyond that. But when I met the founder of Freed and learned his story for why he started it, and started talking to some of the Freed customers and looking at Reddit forums about people who are using Freed, I was really blown away by the benefits that Freed was having. And so, the founder of Freed actually started it because of his wife, who's a family medicine physician. So it was an engineer, originally worked at Facebook. Then he ended up leaving to start his own company. It was a software procurement company for the government space, and he worked on that for 5 years, shut it down because it didn't really um, product market fit. And when he shut it down, he was thinking about what am I going to do next? And that's when he started. That's when ChatGPT was introduced, and he started playing with it. And he thought, oh, I wonder if I could use this to help my wife, who was always writing notes. So every night she came home from work, she would say, I have to go finish my notes. So they couldn't have dinner together. Every weekend, before they could hang out, she'd say, I have to go finish my notes from the week. And so he thought that maybe he could use this technology to help his wife write her notes better, faster. And so he actually hacked together something and showed his wife, and she kind of said, yeah, it's okay. Maybe I'll use it." But being a persistent founder that he was, he then showed it to a bunch of her friends who were also residents in her program. And a lot, and the feedback he got was really, really incredible. That's when he knew he had something. So that was back in 2022, and um, so he started Freed and very quickly started getting traction. He was seeing clinicians start to adopt it and use it. And today, I think AI Scribe is kind of everywhere. There's probably over 100 companies that offer AI Scribe features. There's AI Scribes that you can get for free now, like Doximity or Open Evidence. But back then, it was very new, and so Freed had to really navigate how do we, convince, physicians and other clinicians that this is safe and secure and compliant, HIPAA compliant, and can be used for something as sensitive as, writing notes and recording and writing notes from a patient visit. So yeah. So, anyways, I don't want to keep going on too long, but that's the introduction. That's how I got involved, and I joined. There are about 8 people on the team. We now have over 60 people on the team. We raised the Series A round last year, actually, $30 million round from Sequoia. And we've grown pretty significantly since I joined, from, a couple thousand paying clinicians to over 25,000 paying clinicians today in just a couple of years. So it's really, really fast growth, and really excited about the benefits that it's having, but also about what other benefits we can offer using AI that is in addition to being an AI scribe. So I'll pause there, Arman. Sorry, I kind of blattered on for a while.
No, no, I love it. And I'm sure every single student really appreciates and is inspired by just how many different experiences and especially across how many different areas of medicine you've worked in. I think it's something that as students interested in tech and attending this type of session, uh really something that is amazing and so glad to be hearing the detail. Uh we'll go ahead and get started with the Q&A. So I'll start off kind of easy just because we have a huge variance within our own user base and the students who are here today of uh, of kind of how much people know about the AI world, the startup world, etc. So we'll start off with just like for anyone who's not familiar with Freed or has never used it before, could you describe kind of the current offerings of Freed, like how an AI scribe works and how it compares specifically to other AI products built for physicians and providers?
Yeah, sure. So actually, when I was an undergrad, before I went to medical school, I was a human scribe, and I worked in the ER, and I would help the ER physicians write their notes. And human scribes have been around for a very long time. The problem with human scribes is they're very expensive, and they're human. I was there for about a year because I left because I went to medical school, and an average tenure for a human scribe is around 10 months. And average cost for a human scribe is close to $5,000 per scribe. And I can only work so many hours a day. I may, as a human, may get sick. I may take vacation. So the difference, I think, with an AI scribe is AI scribe never gets sick, never gets tired, uh, never takes vacation, and never quits. Um, and so the way Freed works is it records the conversation you're having with your patient. Although some clinicians also will use it sort of more like a dictation tool, like they will just sort of dictate a stream of thought into Freed rather than using it in the actual patient visit. And I see that pretty commonly with people that work in the inpatient setting, because oftentimes it's you're reviewing labs and imaging and going through outside records, and a lot of these clinicians would just dictate into the microphone what they're seeing, sort of really stream of consciousness. And then after the recording ends, Freed will first transcribe it. So transcription using um, that in itself is new technology. So very different than traditional like dragon dictation and how they were transcribing recordings. Um, that actually uses generative AI as well, and more specifically the Whisper technology that OpenAI developed. And once we have the raw transcript, Freed puts that raw transcript um, into the generative AI to actually write the clinical note. So when we first started, we only offered SOAP note format. So we had different prompts for each section. So we had a prompt for the subjective section, so we write the subjective section based on a transcript, and then a prompt for objective and a prompt for assessment and plan. And actually, before I joined, when I was first kind of exploring what free did, I played around with it because they offer, free demo. And I just pretended like I was having a patient doctor visit, and pretended like I was both the patient and the doctor. And I didn't change how I would normally talk to my patients. I just spoke naturally to my patient. And at the end, the note that came out was not just a word for word transcription. It was really a structured clinical note, one that I can just, quickly look at, maybe add a few things here or there that maybe that wasn't stated out loud, and sign it. And when we surveyed the free users, we asked them, how much time is this saving you? On average, our clinicians are saving about 2 hours a day. So you can imagine that time saving allowed them to do so much, right? Um, a lot of feedback we were getting was, I'm able to, eat dinner with my family. I'm able to go work out. I'm able to, some people actually said I'm able to see more patients, which is not exactly what we necessarily want, but for some people that, that's what they want, and that's great. And just the feedback was, it was really just a huge time saver. But what was more I thought more exciting was patients would also tell us, or tell the physician, who then told us, I love that you're using this technology because now I feel like you're talking to me, and rather than being stuck behind your screen trying to type your note while you're talking to me, right? I mean, that's become before, when medicine, uh, previously, you're talking about laying your hands on a patient, you talk about looking them in the eye while you're speaking with them. A lot of that's changed today. Most doctors, they're trying to write down everything in the note on the computer while they're in the visit, because they have 15 minutes to see patients, and they're back to back to back throughout the day and have no time to write their notes. And so now doctors are turning on Freed, and recording it, and just sitting there and talking to their patients, and being able to look them in the eye while they speak to them. And they know that everything is being recorded, so none of it is going to be missed. And that's the other feedback we were hearing was, there were things that they would have forgotten uh, previously to write in their note or to bill for, that Freed would include. It's like, oh yeah, I did mention that, that we would adjust the hypertension medication. Maybe I would have totally forgotten that if they were working on their note later that night, or that weekend. So it was actually leading to better care, which was also to me really exciting. Um, So and then, yeah, once the note's written by the AI, the clinician can just copy and paste it into their EHR. We also are working on different ways to integrate with EHR so they don't even have to do the copy paste step. And that we can talk about that a little bit more. That's a little bit newer. Um, but that's basically what it is. It records a visit, writes the note, structures the note in a way that's, expected for a clinical encounter, and then allows them to just copy and paste into the EHR.
Yeah, I mean, that's awesome. And as someone who's personally used it and been shown freed by my own parents who use it in clinic, it's just like it's so amazing to see that building for physicians can lead to, the physician being happier, the patient being happier, and just kind of like this whole flip from what you see with cases like, the initial adoption of EHRs in general and kind of that old wave of technology that wasn't built with physicians in mind. Um, but yeah, with the capabilities of Gen AI changing and improving so quickly, you kind of touched on this a little with the founder building for his wife and then her not liking it initially. How has Freed's offering changed since the early days, and like what have been the biggest lessons in the process?
Yeah, and actually, so when he first built Freed, his wife was still in residency. The cool thing was when she graduated residency and she was applying for jobs, she had two offers that she was interested in, and one of them actually used Freed, and one of them didn't. And so, of course, she took the job that used Freed, and so she's not only, and so now she uses Freed every day, and so she's obviously very supportive since it's her husband's company, but also she's, our biggest source of feedback too, right? And everyone in her clinic also uses it, so she'll get feedback from them as well. So I think, yeah, I would say the biggest difference between Freed and other competitors is that Freed really, really listens to the physician customer and takes their feedback into consideration when thinking about what features to build. And Freed is really focused on the small, medium-sized private practices. It's not really targeting the large health systems like the Mayo Clinics or the Kaisers or the UCSFs, where most of those enterprise systems are using Epic, and Epic has its own partnership with different companies like Abridge or Ambiance or Microsoft's Nuance. So Freed is really targeting that long tail private practice of clinicians. And I think that because that's the focus of Freed, the feature set that we're building is going to be very different because the private practice clinician has different needs than a health system clinician. And I would say, so when I first joined, it was just writing a SOAP note. And it used actually the same prompt to write the notes, regardless of what specialty the clinician was. And you can imagine that a internal medicine doctor has a very different expectation for what their note looks like than a psychiatrist or pediatrician. And what was really interesting to us is while we developed it initially for primary care clinicians, we found very quickly that people of all different specialties were using the product. We were seeing a lot of people in the mental behavioral health space using it. So these are like psychologists, social workers. Back when before AI, when it was only human scribes, because it was so expensive, you typically only saw certain specialties that had high revenues able to actually use a human scribe. So those are like emergency medicine, orthopedics, but uh, pediatricians and family medicine clinicians just didn't have the budget usually to pay for a human scribe. So Free obviously changed that because it's less than $100 a month. Which is much, much cheaper than a human scribe was. But we were seeing, I remember talking to a social worker at a school, and she told me she made about $60,000 a year, but she loved Freed and she would never give it up because it was saving her 2 to 3 hours a day. And so for her, it's worth the $99 a month that she was paying. And you never someone like that would never have been able to afford a human scribe to help her write her notes. But what's really cool is the writing the clinical note is a really awesome wedge because if you think about what's in a note. For example, all the diagnoses are in the note, right? And that helps with billing. So we actually have launched, medical coding. So the ICD-10 codes from the visit are automatically populated. We also know what medications are being ordered, what labs are being ordered. So things that we're working on is how do we make it easier for the clinician to then, send that prescription or send that lab order out. Um, and on top of that, as people use Freed more and more, and they're seeing patients over and over again, we start to build a store of record on that patient. And so we actually recently launched a new what we call pre-charting feature, where um, when they're starting a new visit, Freed will actually take all the previous notes and using generative AI, it'll summarize it and show it the context to that clinician before the visit. So now, when I was, for example, in my intern year working on medicine or an ICU, our notes like would just get so bloated over time because you're just copying forward everything because you just want to be able to read uh, about someone's entire course of care, in one note. So you're often copying forward information from the first day. You can imagine someone who's been in a hospital for 30 days, how long this note gets and how, sometimes there's things that just don't matter, right? And that's a very common practice to kind of copy forward. And the reason clinicians do that is because we want to make sure we have all the information that we might need, right? Is if they develop uh, a new fever, like we want to know, like, were they previously febrile, like what did we treat them with, like what could this potentially be, like there's just so much information from their course of care. And so Freed is actually now able to do that summary for them so they don't have to have this note that is just full of entire course of care. It actually will read every note that is in the Freed system and summarize it, pull it all together. It also will remind them, hey, this is what you ordered or recommended or changes that were made in your previous visit. So here are things that you want to follow up on in this visit. And we also allow them to upload outside records. So, it's very common for people who are coming in, new patients, to bring their outside records with them. I remember, or my younger brother, who's a oncologist at Sloan Kettering, he tells me that new patients will come in oftentimes with 100 pages of outside records, and he has to go through all 100 pages to kind of make sure he understands their entire course of care leading up to that point. And so Freed now developed a way that you can upload that outside record and it will summarize it for them and allow the clinician to ask Freed for specific information. So did they have these labs done? Did they have these EKG done? And similar to just chatting with the chatbot, you can actually chat with Freed, and it'll go through and it'll pull out the information from the record. Um, what else? Some other features we developed. So I mentioned the EHR integration. So we actually have an AI agent that can look at someone's EHR screen. And I don't know how much experience people here have with EHR, but every EHR is a little bit different. Some EHRs, when you're writing a note, it's one, page, right? Similar to like a Google Doc or Microsoft Word. And some EHRs, every field is a different box, text box. And sometimes those text boxes are located on different tabs where you have to, click forward to see the next screen. So you can imagine for someone who is using Free, they may have to copy and paste the subjective section into one field and then click to the next screen to copy and paste the objective section and then go to the next screen to copy the assessment plan. So Free actually created an AI agent similar to Operator that OpenAI developed, right? That can navigate web pages. The AI agent can actually navigate the different screens and find where these fields are and copy and paste the relevant sections into the EHR for the clinician. So it saves them, many, many clicks for each visit. Um, so those are some of the new features that we've developed recently. And I would say one of the more popular features we've also developed is more customization. As I mentioned when we first started, we had different prompts for the different sections of a SOAP note. We now offer multiple different types of templates. We also created new prompts for different specialties. So if you're a psychiatrist or a psychologist using Freed, you're going to get a different note that uses a different prompt to write your note than a pediatrician or a family medicine doctor. And I was actually super involved in writing those prompts and creating the prompts for these different specialties. And that actually, I would say, is one of the bigger differences between us and other AI scribes. Is it's just much more customizable and personal to the clinician. We also have something called Learn Format, where Freed can learn from your previous edits and apply those edits to future notes. So, some people are very particular. I'm actually very particular about my notes, and I like to format it a certain way. I might use bullets here, paragraphs here. I might like different, how I order my different sections, use headings here. And so Free can actually learn what the clinician is doing and when they make those edits, and then automatically apply those edits to future notes. So that's actually a really popular feature, probably one of our most popular features.
Yeah, well, I mean, thank you so much again for the detail, and it's super cool as someone, working on our medical education startup to see the analogies between how you kind of build out the depth of each feature and also how the kind of features expand and change as you gather the user feedback and grow. And it sounds like, Freed has been developing since day one and has a lot coming every day. I actually didn't know about pre-charting myself. And like that sounds amazing as somebody who just yesterday for research was going through a faxed in, like
Yeah.
note from a prior visit, and really great to hear the summarizing feature specifically. But moving forward, so I mean, you're here in front of, like you mentioned, a bunch of medical students who have limited EHR like use in their history so far. Um, may not know a ton about, even how the tech works in the current state of medicine, but also who may not know about AI, and they have this anxiety around AI replacing doctors is what they've heard, or kind of like AI being risky or hallucinating or any of these types of things. So I'd say, what's your advice to a doctor or med student who hasn't interacted with AI tools, or even more negatively, who like views them as a threat?
Yeah, I think it's going to be v- very long time before AI can replace a physician completely. I think what will happen is that physicians who use AI will be much more effective, efficient, and a better clinician than physicians who don't. It's kind of similar to physicians who don't use the internet, right? So you can imagine if you had a question, a clinical question about your patient. If you didn't use the internet, you would have to go to the library, find a relevant journal that might have an article that applies, and you can imagine how much time and effort that takes. Versus when you have the internet, you can search, find that article online, and be able to read it quickly, and you have your answer. So I think that as a medical student, using AI as much as you can in your training is going to be the most uh, effective way to be able to practice AI first. And I think that's really important because you already brought hit on this. Hallucinations are very common with AI. We see it with Freed, and we had to build a lot of different ways to address it. For example, we have real-time validators that look for hallucinations in the notes, and if it sees it, it will actually regenerate the note. Um, and when I say it happens a lot, it's you're talking like single-digit percent. But when you're writing 3 million, 4 million notes a month, 1% can actually be quite a lot of hallucinations. And sometimes the hallucinations are not so significant that it has an impact, but sometimes it can, right? And sometimes, you have to think about like maybe it just didn't get a good transcription of what happened, and that's why it had the issue. But sometimes AI, when it doesn't have the necessary information, it kind of fills in the blank, which it's really not unlike what humans might do, right? Like if you're a human scribe, and we heard this from people who switch from human scribes to Freed. Um, Sometimes if they're human scribe, will sometimes write something incorrectly or mishear something, and they would write something incorrectly. And we don't call that a hallucination necessarily, but that really is the same as what AI is doing. Um, and so I think that when you're using AI for example, if you're using it for clinical decision support, right? You're using it to help you treat your patient. You really have to know one how to ask your question, which we call prompting in the generative AI world. So how do you prompt the AI effectively? And the best way to learn how to do that is to use it. So a really good tool that I use is Open Evidence. It's a great sort of like an up-to-date meets Google using generative AI. Um, And I've really stopped using UpToDate, and I've really mostly used open evidence now to for clinical decision support. Uh, but I think it's really important knowing how to prompt the AI. So, when you're writing your query, I would not, for example, ask them, um, "How do I treat this patient?" or something like that, right? Um, you know, I would actually ask it, what are some of the relevant guidelines or treatment protocols for this condition for a patient, and include, cite your sources. And open evidence actually includes a link to the sources, so you don't even need to say that in open evidence. But um, I've learned over time using it um, to write good prompts when I'm asking it for a clinical decision. And that's really important because if you ask it, you just ask it, "Hey, how should I treat this?" It might give you an answer, but you might not know is that actually the right treatment for your patient. But when you ask it or prompt it in a different way, and it gives you the evidence and the guidelines or the papers to look at, um, then you'll be able to really assess it and say, "Okay, yeah, this actually does apply to my patient." And that actually goes back to something even more basic, is learning how to evaluate, studies, right? And that's something that you learn in medical school. You learn how to read a research study. You learn how to understand the differences between a meta-analysis or a randomized controlled trial or uh, observational study. You learn how to look at, inclusion exclusion criteria. These are all really important because if you're just looking at the title of a paper or the headline or even the abstract, these nuances often get lost. And if a study only applied, if the study only included healthy 40 to 50-year-olds, um, that treatment may not be applicable to your 75-year-old really sick multiple comorbidity patient. And you have to be able to distinguish that. And the AI, if you just ask it, like, "How should I treat this?" It won't distinguish that either, right? So that's why it's really important to understand how to prompt the AI. And it's also really important to know how to evaluate what those recommendations are coming from. So I think a lot of it is learning how to use the AI tools, and that really just comes with practice. And understanding that your practice as a physician is going to change over time. I mean, I've already seen changes in my practice from when I was in medical school to residency to now practicing. Um, Things are changing, and if I don't adapt to it, um, then you know, I think that while I'll probably still have a job, I just won't be as effective and efficient and provide the best care possible. Um, and I think it's actually really exciting that this new technology is coming out because it'll make practice much more efficient. And everyone here has probably heard about sort of burnout epidemic with physicians. And we've actually had I remember one doctor very early on write in to tell us that um, they were actually about to retire and close down their practice because they were getting so burnt out. And a lot of the burnout was coming not necessarily from the patient care aspect, was from all the administrative stuff that they were doing, right? Prior auths, writing notes, responding to inbox messages, all that other stuff. And when they started using Freed and they started saving, 2 hours a day, they said, "I really feel like I found the joy in practicing medicine again. And I decided not to shut down my practice and continue practicing." So stories like that, I think, that show how AI can really help and improve the quality of what being a doctor means. And I also think that AI will enable all of us to practice at the very top of what's in terms of quality, right? And it'll turn a bottom or percentile doctor into a high performing doctor because you're able to apply knowledge and evidence that maybe you didn't have time to learn because you're so busy. AI can help you with that. But knowing how to evaluate the evidence and if it's applicable to your patient, all that stuff I think is very important. Otherwise, then why else are you there? I mean, a patient can go use ChatGPT just as easily as you are. So you have to really be able to understand when those nuances come into play and how to apply that.
Yeah, absolutely. And I want to just take a moment to emphasize what Dr. Jang said there of like for all of the people here who are tuning in, who are listening and showing that curiosity, kind of getting to know the field and getting to know the technologies that are out there. Um, exactly as he's mentioned, just you guys are the ones who are putting yourselves ahead, who are trying out these things, who are going to be able to faster adapt to the things that are changing in the future of your careers and our careers together um, as just the early adopters of benefiting from these technologies as early as medical school. Um, Jack, in the interest of time, I think we've got one more question for you. Uh, I'd love to hear your kind of world build of looking, if you look forward 15, 20, even if you want to go as far as 100 years, how do you envision like an AI native patient care experience? And if you had to bet on a short-term and long-term like specialty or area in medicine where you think it's under-recognized, AI will make a huge impact, what would you say that is?
I mean, that's a really good question. I think it's really, really hard uh, to imagine what the world's going to look like, that far out, that many years out. Um, I think if you ask people back in the day what they wanted for transportation, they would have told you a faster horse. And I think that right now, most of us are operating in under the um, sort of thinking of how can we, make certain existing workflows and processes more efficient using AI, right? So that's what I'm seeing as an investor, for example. A lot of the companies that are building, in early stages, they're using AI for voice agents to help answer patient phone calls for scheduling, voice agents to call insurance companies for prior auth, and um, using AI for revenue cycle management and billing and coding. These are all existing processes that are just being made more efficient using AI, and you're replacing, human labor with the AI agent. And I think that's really important because that's the world that we're operating in today, and that needs to happen. But what I think is really going to be transformational is when people start thinking um, completely differently about how we approach healthcare, because we now have this sort of technology, right? If you think about an app like Uber, it required smartphones that had GPS technology and wireless connectivity, and people having every person having that in their pocket, and Google Maps API, all that had to come together in order for Uber to work. And AI is similar, where I mean, it's a culmination of all the um, you know technology that humans have developed up to this point for AI to work. And I don't think we've actually really been able to rethink about how this is going to impact um, what we do. And so I think predicting it super far out is just, it's impossible. I think in the short term, though, you will see AI being used in all aspects of the workflow, to, writing your notes, to submitting claims, to scheduling. Um, I'll give you an example. When a patient calls to schedule an appointment, they're usually talking to, not a clinician, right? A front office staff. And they're telling them their chief complaint, right? And for someone who's not a trained clinician, that's all they really can use to schedule them, right? But they're not able to really understand like what is, ask the questions, the probing questions to understand like how important is this? How do you actually triage? Like how quickly should this person be scheduled? Do they need labs and imaging before they even see the doctor, right? Because oftentimes see a patient, you then have to send them to get labs and imaging. Like how much of that can actually be done up front to make that actual patient encounter much more efficient? Um, I do think that that is something that's going to be in a very short term possible, in addition to also checking their insurance and making sure they have eligibility, and how much is it going to cost them to do that visit. Um, I think what's really exciting that I'm starting to see is previously all this technology is being used for text and even some voice, and you're also starting to see some video and image, but not too much of things that interact in the real world, right? And what I've am starting to see is people, like even surgeons, are starting to experiment with using AI to perform robotic surgeries. And that's when the AI technology is actually interacting with the real world, physical world. And that to me is really, really exciting because, um, you know, I'm an anesthesiologist, so I'm in an operating room. A lot of what surgeons do, you know, does not necessarily require their expertise to do. You can imagine closing, a wound or dissecting down. Like there's just things that, uh, you know, it's not the best use of their time, but they have to do it because no one else can do it, right? So you can imagine a world where surgeons are able to offload some of those aspects of surgery to an AI. And there was recent study, I think it was out of Hopkins, where they did a cholecystectomy, removed the gallbladder for a pig using robotic surgery using AI. And the AI was able to not just able to perform the surgery, but it was able to get itself out of situations or address situations that were unexpected, which is what a human would do. Right. So, maybe this person's anatomy is slightly different than what you've seen before. A human can, you know, synthesize what their knowledge experience and actually perform that surgery still. The AI they found in this study was able to do the same. So to me, that's really exciting is when AI starts to interact with the physical world because that really opens up a lot of possibility. Um, I happen to live in San Francisco, where you have Stanford close by, you have UCSF, some of these really great academic institutions. So as a patient, I have access to some of the best physicians in the world. But there's a lot of places that don't have that kind of access. And if we could potentially give that access through this technology, imagine a surgeon who is supervising from hundreds of miles away a robotic surgery, someone's being done in maybe sub-Saharan Africa, and the AI is doing most of the surgery, but then the surgeon can jump in if it needs to when something arises. Then that person in Africa is getting the same level of care that someone here in San Francisco might get at one of the academic places. Like to me, that's really exciting because that um, I think the US actually has really excellent healthcare, but it's very unevenly distributed today. And I think if we can distribute it better, I think we really do need this type of technology in order to do that.
Yeah, 100%. I mean, I'd love to hear it. A really, really optimistic view on rural medicine, on international medicine, and on medical equity in general. And I mean, yeah, I totally agree. I mean, one of the things I hear about a lot in like my tech circles outside of medicine is kind of this like joke that's becoming less of a joke about a one-man company. And I almost envision that like once the operations with AI get good enough and we hear so much about administrative bloat, being able to bring back the physician-owned practice and have a one-man clinic would be the dream. But yeah, so with that, that was our last question. Thank you so much, Dr. Jack Jeng, and thank you so much again to everyone who attended. I just want to take this time while we're closing out to highlight some of the things that Jack had mentioned and really for anyone who's not familiar with Neural Consult, to kind of highlight what we've been building here. So, I mean, a lot of the things that Freed's ethos is based off of, and that Dr. Zhang's own career is based off of, is kind of this idea that there's novel technology being built, and that we want to be the ones to, adopt it correctly, to use it for the human aspects of medicine, and to learn better, to take better approaches. And with Neural Consult, as I mean, I think everyone here I'm looking with has maybe interacted with me before, has definitely interacted with the site before. But we really want to bring a safe, scalable way for medical students from the earliest stage in education to be interacting with these tools, to be gaining comfort and familiarity with how AI works. Um, and we now serve over 45,000 students across 8 different languages and like countless countries. Um, so it's been a great ride. And for all of you who are watching today, like Dr. Jang mentioned, whether it's exploring tools that are out there, Neural Consult or not, getting familiar with AI, studying with it, getting more efficient with it, learning the drawbacks, learning the aspects you like, and building your familiarity up, we strongly encourage it. And for those who are even more interested, If you haven't met me, I'm Arman. I'm the head of community at our company, and you can work with me to really be a leader in bringing this AI technology to your campuses, to your schools and your communities. And we've been putting on some super fun events, been having speakers like Dr. Jeng out here to inform the community, and also just kind of really giving students a way to engage at a core level with the tech. So. Without further ado, it was a pleasure to have you, Dr. Jeng. Thank you so much for being here and for sharing your insights on Freed, on your entire career, and on what students can do, from this stage in their education to be positioned as leaders within the field. So thank you again.
Thanks for having me. And if anyone's interested in learning more about free, go to the website. It's free.ai. You can actually try the technology out for free. And if you are interested in using it, we do offer a student and resident discount, 50% off. So you just have to write into this customer support with a picture of your student ID or your badge, and they'll apply that discount to your account. So um, and if anyone here has any follow, I saw there's a few questions in the chat. I'm happy to talk to anyone about more about my experience and everything. You can just send me an email at jack@getfree.ai. I'm happy to chat with anyone who's interested in learning more about different aspects of free or the tech or startup world.
Cool. Well, thank you so much, everyone. We'll go ahead and hop off now, but appreciate you again, Dr. Jang, and thank you so much for your time.
Thanks, everyone. See you, Arman.